Welcome to Learning Thursdays. I'm Dean Hale with the OASAS Learning and Development Unit and your host for today's presentation. Today's presentation is titled Intersections of Domestic Violence and Substance Use, Engaging with Victims and Perpetrators. And my guest is Bonnie Allen, Assistant Director of Community Outreach from the New York State Office for the Prevention of Domestic Violence. Bonnie will be joining me in just a moment, but first a word about Learning Thursdays. Learning Thursdays are offered to behavioral health professionals as a free learning opportunity with the goal of improving the knowledge and skills of the New York State substance use disorder workforce as we strive to improve the lives of individuals needing prevention, treatment, recovery, and harm reduction services. A goal of Learning Thursdays is to support the professional development of the treatment, prevention, recovery, and harm reduction workforce. We do this by offering regular presentations that are relevant to today's substance use disorder treatment professional. As always, if there are any questions, comments, or suggestions, please feel free to contact us at the Learning Thursdays mailbox. You can use the same mailbox to express an interest in providing a future Learning Thursdays program. And now it's time to start the presentation and welcome our guest.
Good afternoon, everyone. My name is Bonnie Allen, and I work for the New York State Office for the Prevention of Domestic Violence. I've worked with the office for 10 years now, and a lot of my work at OPDV has been around the intersections of domestic violence and health. And so that includes behavioral health, mental health, and physical health. I'm excited to be here with you today, and we're going to be, I'm hoping at the end of our session today that you will have an increased awareness and understanding of the intersections and prevalence and co-occurrence of DV and substance use. I hope to increase your skills to respond to victims and perpetrators of domestic violence in ways that are trauma-informed, survivor-centered, and culturally responsive. And we'll be talking about that, what that means. And I'm also going to be providing you with some information on how to access services and supports for victims and perpetrators of domestic and gender-based violence. OPDV is the only state agency in the country that has a cabinet level, executive level state agency that deals with gender-based violence. And so that really speaks to a statement of our values and a statement of New York State's priorities in addressing gender-based violence. And so we address gender-based violence at OPDV through several different ways, through public policy, through education and public awareness, and through a statewide services network. So we do a lot of trainings like this to any groups of professionals that want to have a better understanding of domestic violence. We train law enforcement, we train attorneys, we train home visitors, we train healthcare providers, we train child welfare workers, we make recommendations around public policy, and we also hold and oversee a network of domestic violence service providers. So once a month, every domestic violence service provider in each county of New York State comes together and we talk to them about what's happening on the state level and tap into what do they need from the state, and they share with us their struggles and challenges and successes that they're working with. We have three pillars that we hold high in our work at OPDV. They are to be survivor-centered, trauma-informed, and culturally responsive. In all of our work with survivors, we are committed to making sure that they are receiving services that meet these three pillars. Before I begin today, I do want to acknowledge that this topic of domestic and gender-based violence can be a difficult topic to address. It can be a difficult topic to listen to. And so I want to encourage you today to do anything you need to take care of yourself while you're listening to this presentation. You also have access to the New York State Domestic and Sexual Violence Hotline number. That is a great resource for your clients and families and people that you're working with, but it is also a resource for you. So if there's anything about today's presentation that's difficult, you are welcome to reach out to that hotline or to the crisis text hotline that OMH oversees and works with. So I want to start by defining gender-based violence. It is any harmful threat or act directed at an individual or group based on an actual or perceived sex, gender identity, sexual characteristics, or sexual orientation. Gender-based violence encompasses, but is not limited to, physical, sexual, psychological, emotional, economic, and technological abuse or harm. Threats of such acts include harassment, coercion, and arbitrary deprivation of liberty. So when we're talking about and defining gender-based violence, we want you to think about it as an act of violence that is directly related to or justified by using the gender of the victim or survivor, and to be aware that gender-based violence can be perpetrated by an intimate family member, a neighbor, or a friend, and it can happen anywhere. The term gender-based violence is really an umbrella term and an overarching term. And so this training is going to focus on two components of gender-based violence. We're going to talk a lot about domestic violence today, and we're also going to do provide some information on sexual violence, because there's a lot of intersections between sexual violence and domestic violence. So I want to start with giving you a little bit of data and statistics. Domestic violence affects millions of people in the United States each year. Data from the CDC's National Intimate Partner and Sexual Violence Survey indicate that about 1 in 4 women and nearly 1 in 10 men have experienced contact sexual violence, physical violence, and/or stalking by an intimate partner during their lifetime. Right? And so what we see is that there are, this is a very, very prevalent issue, right? And so when you're working with individuals or families in any capacity, it is likely that you will have survivors of gender-based and domestic and sexual violence in your clientele base. For sexual violence, these numbers actually increase to 1 in 3 women and 1 in 4 men who will experience sexual violence involving physical contact during their lifetime. And we know that specific populations or communities, including people of color, people in the LGBTQIA+ communities, and communities with fewer resources, experience domestic violence at even greater rates. And this is due to a concept called intersectionality. And so intersectionality is basically that we experience life, sometimes discrimination, sometimes benefits, based on the number of different identities that we have. The term intersectionality was originally coined by Kimberly Crenshaw, and I'm going to explain it in the way that she does. And so it looks at kind of layers of discrimination. And so Kimberly Crenshaw talks about how Black women are discriminated against, not just as people of color and not just as women, but on both of those layers, on both of those levels. So intersectionality are really those foundational identities that we all have. And they include our race, our culture, our class, our gender, sometimes our age, our socioeconomic status, sometimes our faith or our religion, right? There's nothing that's bad about any of these intersectionalities, but it's important to recognize and understand that we all have these intersectionalities, and sometimes they play a role in gender-based violence, domestic violence, and sexual violence. They may play a role in terms of how people access services and supports, or whether or not they're comfortable accessing services and supports, and they may play a role in terms of what tactics perpetrators attempt to use. I want to define domestic violence now. At OPDB, we define domestic violence as a pattern of behavior used by an individual to establish and maintain power and control over their intimate partner. The behavior includes abusive tactics, threats, and actions that may or may not rise to the level of criminal behavior. A lot of domestic violence does not rise to that level of a crime. The tactics may include physical, emotional, financial, and sexual abuse. And we're going to be talking about the different types of all the different types of tactics. It's virtually impossible to name all of the tactics that people might use, but we're going to focus on some of the specific ones today. So this is a nice way. It's a power and control wheel that OPDB adapted from the Duluth model and their power and control wheel, and we adapted it to include exerting dominance and privilege. We added, because we see so much technology abuse now, we wanted to include that on the wheel. And we also are very aware now of spiritual or faith abuse when someone is using their partner's faith or religion as a tactic of coercive control. And so, like I said, we can't, within each of these categories along this wheel, there are hundreds and hundreds of tactics that people may use. Perpetrators will use where their survivors are most vulnerable, and they will design their tactics around those vulnerabilities. And we know that domestic violence does not happen in a silo. People who experience domestic violence are oftentimes also experiencing mental health issues, substance use issues. They may also be experiencing poverty or homelessness, significant health issues. And so we want to look today at those intersections of domestic violence with substance use and mental health. We do a lot of work with training child welfare workers, and I always say to them, how many of your cases only have domestic violence, right? And they're like, almost none. Most of the people who are experiencing domestic violence are experiencing other challenges as well. And what we know is that, so for a survivor who has mental health or substance use issue, that's a vulnerability. And so perpetrators may sabotage their partner's recovery efforts by deliberately keeping substances in the home. They may encourage them to engage in alcohol or substance use. They may interfere with their taking their medications. So I want you to take a minute and think. Abusive partners often cause a survivor to use substances, make a survivor's substance use worse, B and C, or all of the above. And I want to say that it is all of the above, right? We know that perpetrators often coerce or threaten to harm or force their partner to use substances as a way to gain and maintain power and control. They may make an existing substance use or mental health problem worse. And so oftentimes perpetrators will also use a lot of guilt and shame around the survivor's substance use. And that can be called a tactic called substance use coercion, right? So we gave you all of those tactics on that power and control wheel, and substance use coercion and mental health coercion are additional tactics. So substance use coercion. Domestic violence often plays a significant role in the development and exacerbation of mental health issues. Abusive partners often use their victims' mental health as a tactic of power and control, and this is called mental health coercion, right? And so just like they use the survivor's substance use, they will use that survivor's mental health. And so they will undermine the survivor's sanity. They may prevent a survivor from accessing treatment and medication. They may attempt to convince a survivor that no one will believe them because of their substance use issues or their mental health issues. And they may intentionally and purposely use gaslighting as a tactic to make that survivor feel like they are going crazy and that they can't even trust their own judgment or their own reality. So abusive partners will often undermine the survivor's efforts to achieve sobriety. They will oftentimes isolate the survivor from sources of support. They will use a survivor's dependence on substances to further their control. They will use the stigma around substance use to call a survivor's credibility into question, including in custody cases. So that sounds like no one will believe you, right? They know the court's going to know that you're addicted. The court's going to know that you're an alcoholic or a drunk. No one is going to believe you. No one is going to give you custody of our children. Law enforcement won't believe you, so don't waste your time calling them. Judges won't believe you, so don't waste your time going to court. Right. Oftentimes, too, they may implicate a survivor in illegal activities and then limit their access to law enforcement. So again, they may use that threat of that survivor's use of substances as a tactic of coercive control. They may videotape or use technology abuse to videotape that survivor under the influence and threaten to put that out on social media or show it to child protective services or law enforcement. They may force or coerce their partner to engage in illegal activities and then use that to hold over their head so that they won't call the police regarding the domestic violence or the gender-based violence. And substance use often involves the use of threats, coercion, and manipulation, right? So we oftentimes see partners really interfering with survivors' attempts to get treatment and services and support. There was a study that was done, a substance use coercion study, and the study really presents some, I think, really fascinating results and really kind of ties together the intersections of domestic violence and substance use. So the study presents findings conducted with callers to the National Domestic Violence Hotline. And what happened was people who called that hotline during a period of time were asked briefly about their experience with different forms of substance use coercion used by their abusive partners. So a domestic violence victim would call the hotline, and in part of their conversation, they would ask about substance use coercion. The survey was conducted by the hotline staff over a period of 6 weeks and involved over 2,500 participants. And the following found the results were found that are on the screen. So 27% of domestic violence victims were forced or pressured to use a substance or use more of that substance than they wanted to. 37.5% of people that called the hotline were threatened that they would to report substance use to authorities to prevent them from getting something they needed or wanted. 24.4% of people that called the hotline said they were afraid to call the police because their partner said they would not be believed or that they would be arrested. And 26% used substances to reduce the pain of their partner's abuse, right? So we see a lot of intersections, right? Between almost 25 and 33%, right, of people who are experiencing domestic violence are experiencing some form of substance use coercion. The study also looked at mental health coercion as well, and found that there was a lot of information also that they were using, that mental health coercion was being used. And some additional information that came across related to the substance use particularly was that 69.7% of the callers who reported that they have used alcohol or other drugs to reduce the pain of their partner or ex-partner's abuse, right? So 60% of the people who said they had used alcohol to cope with the partner's abuse also reported that they had been afraid to call the police for help because their ex-partner said they wouldn't believe them because they were using, or that they would be arrested for using or having drugs or alcohol on them. 60.1% of the callers who reported having tried to get help for alcohol or other drug use in the last few years reported that their partner or ex-partner prevented or discouraged them from getting that help. So I really encourage you to look up and read these studies, because there's just really a lot of information that really shows how perpetrators of domestic violence are either causing that survivor to have substance use issues, making existing substance use issues worse, and then interfering with their attempts and their ability to get treatment or services. And I can provide the link to that survey in a follow-up communication. The other thing that's really important to understand is that perpetrators will use the survivor's substance use to undermine a survivor's parenting and to create fear of losing their children. Using children is one of the tactics that perpetrators use that is a very, very powerful tactic to gain and maintain power and control. And so oftentimes they will combine that substance use coercion with using the children and really undermine the parenting of that person and create and instill fear that that person is going to lose, that the person will lose custody of their children. So some of the ways that perpetrators do that is they talk in front of the children or to the children specifically about the survivor being an addict or a drunk, and they'll do that in front of the kids, or tell the children that the survivor is the one that's responsible for the issues and problems in the house. They may have the children monitor the survivor's substance use and report on when the survivor is using and if any behaviors that were related to that substance use. They'll blame the survivor's substance use for all of the family problems and take no responsibility for any of their behaviors. They will say things to the children like, mommy would rather go to her meetings and hang out with all her druggy friends than stay home and be with us. Or we can't go on that family vacation because we pay so much money for mommy's substance use treatment. Or mommy spent all of our money on drugs, so you can't have that new thing that you want, right? Very purposely, intentionally blaming that survivor for things that are happening in the home in an attempt to turn the children against the survivor and get them to align with them. Let's see if I missed any of them. And then they will tell that survivor, right? No one will believe you. I will let everyone know. I will embarrass you. I will shame you, and I will get custody of these kids, and you won't even be able to have visitation, right? Or threatening to call Child Protective Services because of the survivor's substance use. Very, very powerful tactics. And so there are many impacts of substance use coercion on survivors. Oftentimes that survivor will feel responsible for the abuse. They may live in constant fear of losing custody or visitation of their children. They may have increased fear and anxiety, and they may be worried about their reputation being destroyed. And so you can see on the slide many of the impacts, right? That they will be they may increase their substance use. They may experience anger and anxiety. They may have decreased safety as a result of the substance use, increased fear, loss of respect from their family, from their children, from their community, and they may be at increased risk of harm. Overall, substance use coercion has a chilling effect on the survivors, It limits their realistic options for creating a different life. The implications of substance use coercion may extend to a survivor's ability to access economic support, employment, or social support. It can often create barriers and challenges to accessing safety and retaining custody. This, in addition to the stigma that many people experience regarding substance use, as well as trauma-related feelings that may emerge as a result of being victimized and controlled, right? And so these substance use coercion is really a very powerful tactic, right, to limit survivors' access to safety and support. I'm going to take a moment now and talk about the category of sexual violence. There's a lot of intersections with substance use and domestic violence and sexual violence. So there are significant overlaps, right, between domestic and sexual violence, as perpetrators will often use sexual violence to gain and maintain power and control over their partner. So sexual violence is often a tactics that perpetrators will use. Sexual violence includes sexual acts or activities that happen without consent. So it may include rape, sexual assault, and sexual abuse. Sexual violence includes different types of unwanted physical contact, including rape, molestation, sexual abuse by an intimate partner, child sexual abuse, and groping that may or may not be criminal. So just like domestic violence may or may not rise to the level of criminality, the same is true of sexual violence. A lot of sexual violence or sexual abuse falls under that line of criminal behavior. And so a little bit more data just to talk about the prevalence. We know that 1 in 5 women will be a victim of sexual assault in their lifetime. Women, men, and children of all ages, races, religions, and economic class can be and have been victims of sexual assault. It does not discriminate. Sexual assault on men is thought to be greatly underreported. So we have here 1 in 33 men. That, of course, is numbers that are documented and reported. And 1 in 3 transgender and gender nonconforming people often also experience sexual violence, right? So just like different marginalized communities experience higher rates of domestic violence, oftentimes those communities with less resources often experience higher rates of sexual violence as well. So a lot of intersections of sexual abuse and substance abuse, right? Perpetrators of domestic violence often combine tactics and use victims' vulnerabilities as tactics of coercive control. Abusive partners may force a victim to use drugs. They may force them to engage in sexual activity to obtain drugs, and they may traffic their victims. I just presented at the OCFS Human Trafficking Conference and talked about all of the intersections of domestic violence and human trafficking. Sexual abuse and substance hand often go hand in hand. Women who reported that their partners used substances during sex were nearly 4 times more likely to also report domestic violence victimization as compared to women who reported that their partners do not use substances during sex. Right? Oftentimes, abusive partners will justify their sexual abuse or other forms of violence based on their drug use. They will coerce survivors into illegal activities, dealing drugs, stealing, trading sex for drugs. Oftentimes they traffic their partners. They may be sexually degrading to their partners, both verbally and behaviorally, and they may force their victims to engage in unwanted sexual activity to obtain drugs. There are many intersections of domestic violence and substance use. The connections are complex and intertwined. There's a high prevalence of co-occurrence of domestic violence and substance use, both for survivors and perpetrators. And we know from research and practice that the two issues are correlated, and that substance use is a risk factor for more severe substance use is this is let me get back on track here. The literature on intimate partner violence and substance use disorder in general has found mixed results regarding the timing of the victimization and the development of the substance use disorder. So there is some evidence that drug use may precede abuse by an intimate partner, as well as evidence that experiencing intimate partner violence is related to later drug use. So the relationship is best described as bidirectional, regardless of which issue is present first, right? So sometimes the IPV may put person at risk of substance use. Sometimes the substance use may put a person at risk of IPV, right? But what we know regardless is that drug use and acts of violence only exacerbate each other's effects, right? So if IPV is present or domestic violence is present, substance use is going to make that worse. If substance use is present, intimate partner or domestic violence is going to make that worse. We know that between 55 and 99% of women who use substances have been victimized at some point in their life. Again, strong intersections. 67 to 80% of women in substance use treatment are victims of intimate partner violence. And we know that the correct answer here is D, right? That a study of women who attended a methadone clinic found that 90% had experienced IPV in their lifetime. Overall, studies suggest that most people, particularly women who use opioids, have been abused by an intimate partner at some point in their lives. And so this is how one survivor described the intersections of domestic violence and substance use. They said, "I couldn't recover from substance abuse if I was still physically and mentally abused, because I would be right back to using. So they walk hand in hand. I would not recover from one unless I addressed the other, and vice versa." We also know that survivors who are abused and living with substance use issues face many unique challenges. They are attempting to survive in a world that condemns both their substance use and their choice of a partner, right? So the stigma is almost doubled. Right. There are many things that we want to consider and think about when we are addressing the intersections of domestic violence and substance use. We want to know, is the survivor using substances? Is the perpetrator using substances? Are they both using? Are they using together? Is the survivor being coerced or forced into substance use? They just talked about opioids. I did a trauma group for women in county jail, and I would say probably 80 to 90% of them were addicted to heroin. And many of them, their first time they used heroin, they were forced by a family member or partner to be injected by heroin. We want to know, what role is the substance use playing? How is the perpetrator using the survivor's substance use as a tactic to gain and maintain power and control? Or how is that perpetrator using their own substance use as a tactic to gain and maintain power and control? So we talked earlier, right? They may use the survivor's substance use to instill fear about getting custody, or to make that survivor think that no one will believe them, or to discredit them with certain systems. The perpetrator may also be using their own substance use by saying things like, I only am abusive to you when I drink or when I drug. I promise I'll stop drinking. I promise I'll stop drugging. I'll go to treatment. I'll get help, right? So they may also blame the survivor for their substance use issues. Oftentimes, survivors of domestic violence are not comfortable disclosing, and there are many really valid reasons why they may not disclose, right? And fear is one of those biggest things. Fear of future abuse. Oftentimes, they may have been threatened that if they tell anyone, there will be additional abuse or additional consequences. Oftentimes, they want to protect their self, children, pets, and family members, and they may even want to protect the abuser, right? They may want that abuse to stop, but they may not want that abuser partner to go to jail, right? They may not want them to lose their job. They just oftentimes want the abuse to stop, and they're afraid, right? If that person is incarcerated and they lose their job, then maybe there's no support for the family. Or maybe they're afraid if that person goes to jail or is incarcerated or has legal consequences, that may escalate the violence or the abuse that that perpetrator is engaging in. Oftentimes, survivors have a lot of shame and embarrassment. They blame themselves. Perpetrators will tell the survivor it's all their fault. They will tell them they're a bad person, they're a bad parent. And they will, sometimes survivors take that on, and they really do have a lot of shame and embarrassment and believe that it is their fault. Oftentimes, survivors have had negative experiences with systems in the past. Unfortunately, oftentimes our systems do fail survivors of domestic violence. And so if they've had a negative experience in the past, or they've been afraid of losing their children, or threatened to lose their children, they may be less likely to confide in systems and trust that the system can actually help them. A lot of fear around losing their children. That's even just for victims who aren't using substances. If a victim is also using substances, that fear increases. They may be concerned that the information maybe not be kept confidential. Sometimes they don't tell anyone because they're not asked, or they're asked in a way that is unsafe or feels judgmental or victim blaming. It's important to look at too how perpetrators show up and how victims show up, right? And oftentimes perpetrators show up being very calm, cool, collected. They may be trying to laugh. They may be charming, really trying to engage with you. Perpetrators may have a visible injury, right? Sometimes survivors fight back, and so maybe they have a scratch on their face. Maybe the survivor was trying to defend themselves, so they have a more serious injury, right? Sometimes it can be really hard to figure out who is the perpetrator and who is the victim. Perpetrators are much more likely to show up and present as a victim. They oftentimes will want to tell you about how their partner is crazy and it's all their partner's fault, how their partner uses drugs, or how they were only abusive to stop or prevent the partner from using drugs. Oftentimes, perpetrators are not going to be forthcoming with information. And sometimes they will not show concern and empathy towards their partner. Other times, because they want you to believe they are a loving, supportive partner, they will express concern and empathy and show up like, I'm only doing this because I wanted to help them. Victims oftentimes, right, they've been walking on eggshells, sometimes for years. They've been living with anxiety, maybe even symptoms of post-traumatic stress disorder. They have been blamed for the abuse. They have been judged. And so oftentimes victims will show up crying, sobbing, distressed, anxious, maybe even hyperventilating. Oftentimes where perpetrators show up not taking any responsibility for the abuse, survivors sometimes show up and will say, yes, sometimes I get angry, or yes, sometimes I call them name, or yes, one time I did scratch them because, so perpetrators are never going to take responsibility. Sometimes survivors will show up taking that responsibility. Oftentimes they're afraid. They also may be angry or hostile even, right? They may have a lot of anger after living with domestic violence and abuse, and maybe the system's not taking them seriously, right? So I think sometimes people are surprised if that survivor comes across very almost aggressive sometimes, right? Because they're like, she doesn't seem like she's afraid of anyone, right? It may be safe for them to be angry with systems and not at home with their partner. So I want to talk now about how do you respond to clients who may be experiencing gender-based violence, right? How you respond is going to make a huge difference in whether or not they confide in you and whether or not they access services and support. So it's really important that when someone is talking to you about their experience of domestic violence, is that you are listening in ways that are non-judgmental, that you believe what they're telling you, that you do not blame them for their partner's abusive behavior. right? You want to offer support and you want to provide them with options and not force them to do anything, right? Their decision ability to make decisions and choices have been significantly limited by the coercive controlling abuse, right? And so one of the things that we can do as professionals is restore to them some of what was that lost, right? So offering options, educating them, respecting their choices and decisions. Oftentimes, it can be really difficult to know what to do or how to approach someone who may be experiencing domestic or gender-based violence. I have been training professionals for years and years and years now, right? And I will say that no one, right, no group that I speak to, whether it's nurses or doctors or judges or home visitors or mental health providers, substance use counselors, I have not really had any group of people say that they are 100% comfortable addressing and talking about domestic violence. And there's many, many reasons for that, right? Oftentimes they are afraid that they are going to make it worse by bringing it up. They are afraid of putting that person at some type of additional risk or embarrassing or shaming that person. They may feel like if that person then confides in them that they are a victim, that they don't know what to do, that they don't have the knowledge and the access to resources that they need. Again, because domestic violence is so incredibly prevalent, oftentimes people in those helping professions or in those systems may have had their own experiences with domestic violence. So they may have biases about that, or they may want to avoid having those conversations. Oftentimes, the professional is reluctant to ask because they're afraid they might do something to cause additional harm or put that survivor or those children at risk of harm. I've had many, particularly in home visiting programs and people that are doing prevention programs, they may be in that home working with that family and being really providing some great services. They may be afraid if they suggest or bring up the topic of domestic violence, that family may not want them in the home anymore and that they won't be able to provide those services that they've been able to provide in the past. So to avoid some of that, we really want to encourage all practitioners to screen for domestic violence and ask about it, but that they're doing it in a way that is routine, that they're doing it with all of their patients, with all of their clients, that they are always asking privately, that they are asking periodically through their relationship with that patient or that client, that they are developing their own way of asking that feels comfortable to them, and that when they engage in any conversation about domestic violence, they are very clear about what the guidelines of confidentiality are, right? And so a way to ask very generally is to say, so many of the people that I see or the people that I work with or the homes that I go into, right, whatever your position is, have experienced control or abuse in their relationships. I just want you to know that that is common, and it's never the victim's or survivor's fault. And if that is something that you're ever experiencing or that someone you know is experiencing, I can be a resource and there is help available. That person does not need to tell you if they are a victim or not, right? You have told them this is common, it's not your fault, their help is available without ever asking them to tell you anything, right? So that's a great way to kind of screen generally and let that person know that they can talk to you about the abuse. If you are substance use professionals, you may want to add to that, right? That sometimes the substance use can make the perpetrators will use your substance use to control you even further, right? And so it's important to know that and that I can be a resource for you. Research indicates that survivors want to be asked about domestic violence when they are asked confidentially, respectfully, and non-judgmentally. So that routine screening really provides an opportunity to start a conversation, to be seen as a resource, and to provide information, right? And then that person can determine if they're comfortable talking to you about that and telling you about that. So as I was just saying, right, successful conversations about domestic violence, successful screening for domestic violence does not require that someone says, I am a victim of domestic violence. That could take months or years before someone is comfortable saying that. Oftentimes survivors don't even recognize that what they're struggling with and experiencing is domestic violence, right? So they can't tell you that they're a victim if they don't understand that that's what's happening. Right. So we don't need them to acknowledge that. We don't need to get them to call a hotline or go to a domestic violence shelter. Sometimes survivors of domestic violence never want to go to a domestic violence shelter, right? They feel like that's unsafe for them and their children and their family. They feel that it may escalate abuse or put them at risk of homelessness, right? Or losing finances, right? And we don't need to get them to leave their abusive partner. That is not our role. And so our goal is to let people know there are options and choices available, and we will help you to get to those options, to identify those resources and have someone to talk to if that is what you want, right? We want to be able to give those universal messages that it's not their fault, that they will be believed, and there's help and support available. So we want to, again, always be engaging with survivors privately. We want to be assessing domestic violence throughout the life of a case, right? We may be working with someone in those first few weeks and do that screen, and they may, not indicate that anything's wrong. Maybe, again, what now we're seeing or working with this person for maybe 3 months now. And so maybe we want to say again, I know we talked about this earlier, but I just want to remind you that, if you're ever experiencing abuse in your relationship, that's something that we can talk about. It may impact your ability to get clean and sober or to stop using, right? We want to adapt the questions that we're asking to be culturally responsive. We want to, again, when we're talking about intersectionalities, we want to always be aware and engaged with how is that person showing up to us? How are those foundational identities impacting how they are with us, whether they even come to us, and how is the perpetrator using those? And we want to be responsive to that. And we want to always be validating that survivor's perspective and experience, right? If they're telling us something, we need to believe what they're telling us. And we want to make sure that we are not being judgmental to them, right? We want to always be empathetic and supportive, right? We want to be patient. We want to ask open-ended questions, not those yes or no questions that shut people down. We want to always be avoiding that victim blaming tone or language. Anytime we say to someone, well, why would you do that? Or, well, that doesn't make sense. Or even saying things like, well, I would never allow someone to treat me that way. All of those are victim blaming statements. We all have a lot of, unfortunately, biases about victims, right? And it can be very easy for us to slip down that rabbit hole of victim blaming. And we really want to always, always try to avoid that, right? And we want to offer assistance without them having to tell us a lot of information. So kind of just what I was just saying, giving them information that there's help and resources and support available, telling them that you're there if they want to talk, but not insisting that they tell you things. So the key messages are, I'm concerned for you and I will support you. I'm available to help with your relationship issues if you need or want assistance. And I can refer you to our local domestic and sexual violence program providers if that's something you're interested in, right? I can believe you. It's not your fault. There's help available. And asking them, how can I help you? Is there anything I can do to help keep you safe? It's important to recognize that there is no mandated reporting of domestic violence. It is not like child abuse. It may be really unsafe for victims if you report the domestic violence to law enforcement, if that is not what the victim wants. Adult victims have the capacity to decide whether or not they want to report the abuse to law enforcement. No one should take away their right to self-determination, right? Even hospitals and doctors are not required to report domestic violence unless, I think there's 3 conditions. If there's like a gunshot wound, a significant stab wound, and I think maybe certain burns. Other than that, there is no requirement for anyone to report when there is domestic violence. All of the requirements around child abuse still stand high. So if you're a mandated child abuse reporter, you need to know what your guidelines are, but there is no mandated reporting of domestic violence. It's also important, right? We're here talking about these intersections because we want you to be aware of how domestic violence might show up in your work, about how people who are using substances or who have a substance use disorder may be impacted by domestic violence, that maybe their substance use is being caused by their intimate partner or exacerbated by their intimate partner. Maybe it's hard for them to show up to it all because of their intimate partner. interfering with them getting treatment and support. We do not expect you to be experts in domestic violence or safety planning, right? We just are really hoping, right, that by being more aware of those intersections, that you can do that kind of general routine screening and let people know that you can get them to services and support if that's what they need, right? We do a lot. Sometimes there are lethality risk assessments and safety assessments that service providers or law enforcement will do with victims of domestic violence. And so those are something that another service is, that could be available, right? Kind of what are the highest risk cases, right? We are not expecting you to be experts in this. We're just hoping that you can provide those messages that we talked about and let people know how to contact resources and services and support as if that's what they want. So you may also have have perpetrators of domestic violence, right? That have substance use problems that are coming to you for treatment. And so just like we want to be careful in terms of how we engage and work with and talk with survivors, we want to also be thinking carefully and cautiously about how we're engaging with people who cause harm. Right. And how, just like how you talk to survivors about domestic violence and services and support can make a difference whether or not they will access those services and supports and confide in you, the same is true for how you talk to perpetrators about domestic and sexual violence. Right. It's important to know that perpetrators are almost exclusively focused on coercive and controlling their victim, right? So their behaviors towards others is often different. They may show up to you, like I said earlier, very charismatic, presenting as a great parent, partner. They may seem like a great client. They may be extremely manipulative, right? I know that sometimes people who use substances or have substance use disorders use manipulation. Perpetrators often are very skilled at manipulating systems as well as that at survivor. So we want to offer services, supports, and referrals, right? We do not want to, as we're engaging and working with someone that's perpetrating domestic violence, we do not want to ever allow them to make excuses for their abusive behavior or their choices. We want to educate them that they are making a decision to be abusive to their intimate partner, and they can make a decision to not be, and that we can support them in that and provide them with services to also motivate them to choose to be non-abusive in their intimate relationships. We want to be very, very clear with them that there is no excuse for their abusive behavior and that abusive behavior is never acceptable in their relationships. And we want to encourage them to address all of their health needs, right? So they may have substance use disorder issues, they may have mental health issues, behavioral health issues, whatever those issues are. We know that there's a lot of factors that may contribute or to the domestic violence or the substance use. And so any of those contributing factors we want to be able to address as well, but we don't want to create a situation where they are then presented as the excuse for their abusive behavior. So perpetrators often present as the victim. I said that as we were talking earlier. So Dr. Emma Katz has a term that she refers to. She does a lot of work around the impact of coercive control on children. And she uses an acronym called DARVO, which is deny, attack, reverse, victim, and offender. And so oftentimes what perpetrators of domestic violence do is they present as the victim. They will tell you how they suffer as a result of their partner's substance use. If they acknowledge any abusive behavior at all, they will minimize it and the impacts and blame the survivor's behavior, mental health, and substance use for their actions. Sometimes they will express concern for that survivor and want to tell you all of the ways they have tried to help that survivor. They will likely tell you that the survivor has done what the survivor has done wrong and describe incidents where the survivor's behavior, mental health, and substance use caused harm to them and their children. Their goal is frequently to get you on their side, to win you over, to make you feel sorry for them, and to see the survivor and their issues as the problem. Perpetrator may also have mental health issues, which they may blame on the survivor and use as an excuse for their behaviors. Right. So there are often additional tactics that perpetrator is going to use to gain and maintain power and control. right? And so we need to be aware when we're engaging and working with perpetrators that blaming, minimizing, and denying are tactics that they use. They use them with the survivor, and they will use them with service providers as well. And so we want to, again, be constantly pulling them back to they are making a decision and a choice, and there is no excuse to be abusive to their partner. So I got ahead of myself. This is the minimize, blame, and deny, right? And so oftentimes we will hear perpetrators say that just didn't happen. So they will flat out deny that they were abusive in any way. If they acknowledge the abuse, they will say that it happened because it wasn't their fault, right? It was their partner's fault. There's the neighbor who called the police fault, the judge's fault, who put the order of protection in place, never their fault. So they'll either deny that it happened at all. If it did happen, it certainly wasn't their fault. Or if it did happen, it really wasn't that bad, right? The survivor kind of added, increased, as a drama queen and added certain things and lies that made it sound worse than it really was. So we want to always be engaging with perpetrators in ways that hold them accountable for their choice to be abusive, right? There's no one profile of a domestic violence offender. The individual, we have a lot of biases, just like we have biases about survivors, we tend to have biases about perpetrators too. But the reality is that anyone can perpetrate domestic violence. The individual may be financially stable, deeply spiritual, well-educated, gay, straight, hold a prominent and respected position in the community, right? It can be women can be perpetrators of domestic violence. We tend to think of only men as perpetrators, but women can also be perpetrators of domestic violence. And so the common thread that links abusive partners together is their choice to use coercive control and violence against their intimate partner, right? Domestic violence offenders' actions are often a learned behavior and not something that they were born with. Right. We really want people to understand that the domestic violence offender's behavior is not considered a disease or an addiction and should not be treated in that way. We must also take into consideration when we're dealing with perpetrators, just like when we're dealing with survivors, all of their foundational identities, right? What is their faith? What is their culture, their race, their religion, and what role is that playing in the tactics that they're using and in how they show up in your office? I know I have a lot in here. I keep seeing like to hold them accountable, right? And that's because it really is so critical. They are so skilled at making excuses for their behaviors and blaming others. So we need to constantly be bringing them back to, you can have any feelings you want, right? If your partner cheats on you, if your partner didn't come home on time, if your partner's using substances and you disagree with that, right? You can be angry. You can choose to leave that partner. You can do all kinds of things, but you can't be coercive and controlling and abusive to them, right? So constantly reminding them that they're responsible for their actions, that they are making a choice. We want to really encourage them in any ways that we can. And this is a way that service providers can hold them accountable, right? If you want to encourage them to comply with any conditions of probation or parole, you want to encourage them to follow all orders of protection and court orders, right? Pay their child support on time. Do not stalk that person. Do not show up at their job or their home, right? If they're mandated to an offender accountability program, encourage them to make it to all of those classes. I think that those are all ways that service providers can also really work and encourage perpetrators to be accountable and responsible for their decisions and choices and actions. When we're engaging with domestic violence offenders, it's really important that we engage with them respectfully, right? If we are putting them down, always engaging with them in punitive ways, we are going to lose the opportunity to educate them, support them, and encourage them to change their behavior. Right. So we want to deal with them respectfully. We want to hold them accountable. We want to pay attention to them as fathers, and we want to educate them that if they are a parent and they are making a decision to be abusive to their intimate partner, that is a parenting decision that is causing harm to their children. right? So they're making a parenting choice when they're abusive to that child's other parent. They are very, very good at like colluding and trying to pull people in. So we want to have real clear boundaries and limits when we're working with perpetrators. We want to always keep that victim's safety in mind and the safety of the community, yourself, and any other partners. We do want to try to find and identify the strengths of that perpetrator so that we can build on those and acknowledge that there are strengths. And we want to pay attention to those intersections and intersectionalities, just like we do with victims and survivors. We know that fatherhood can be a prime motivator for perpetrators to change their behavior. Most men have a strong aspiration to be good fathers. And when you engage with them as a father and talk to them about what do they want for their children, what kind of father do they want to be, what kind of man do they want to be, that can be a way in to help them to make different choices in terms of how they treat their intimate partner. I've said this 100 times. I'm not going to say it again, right? Accountability, accountability, accountability. We want to recognize and acknowledge their strengths, and we want to focus on their behavior. When we can engage with perpetrators, not as if you're a bad person or you're a monster, right? But focusing on the behaviors that they're choosing to engage with and encouraging them to change those behaviors and make different choices. When you're getting ready to meet with someone who you suspect might be a perpetrator of domestic violence, or maybe someone who was referred from an offender accountability program, so you know that you have someone that has a history of domestic violence, you want to have as much information as you can about that perpetrator's pattern of behavior, right? So you want to do your homework. You want to, if you want to know if there's any orders of protection, you want to know if there's a lot of domestic incident reports and arrests and violations of orders of protection. Are they on probation or parole? Are they attending an offender accountability program? Right? You want to always make sure that you are protecting the confidentiality of that survivor. So if you have some information that somehow you have from the survivor, you don't want to share that you got any information from that survivor, right? Even in police reports and stuff. That's a safety issue for survivors. You want to be aware of any biases that you may have related to perpetrators or victims of domestic violence, right? We all have them. Even me, I've been doing this work for 40 years, and sometimes some victim blaming statement will still slip into my brain, or sometimes I'll assume, well, that person couldn't possibly be behaving that way, right? So we need to be very mindful of our biases and make sure that they are not interfering with how we engage with both survivors and perpetrators, right? And we want to think about where is the best location and a safe location to meet with this person who's perpetrating domestic violence. We want to always keep our safety in mind as well as the victim's safety. And I want to ask you to take a moment and think about documentation of domestic violence. We want documentation to be very behaviorally focused, right? So we want to avoid using ambiguous or vague terms like arguing, fighting, engaged in domestic violence, right? Those things don't really tell us a lot. We want to know if someone actually hit that other person. We want to say that they hit that person. Did they hit them with the open hand or with a closed fist, right? We want to use language that focuses on that perpetrator's role in creating harm or risk to the family. So we want to avoid, again, those vague terms. We want to link the perpetrator's abusive behaviors to see them as the source of risk and harm, particularly if there's children involved. And when we're thinking about documentation, we want to, if we know that some of those survivors' strengths and the things that survivor has done to protect and keep the children safe while they're experiencing that coercive controlling abuse, we want to include that in our documentation as well. Right. A lot of time we do a lot of work with child welfare workers. And so this is some of the things that we say to them about documenting the perpetrator's behaviors, documenting the survivor's protective efforts, and being very, very specific about those behaviors and detailed. So an example that we talk about is, so we're not going to just say, right, the father and mother engaged in a verbal argument in front of the child, right? Instead, we're going to say the father entered the child's room where the mother was and began waving her phone, yelling and screaming obscenities at her, which included that you are a whore and a cheater. He threw the mother's phone on the bed, just missing hitting the child, right? Both of those statements are true, but right, that second one gives us a lot more detail and a lot more information. And again, as substance use professionals, you may not be doing this type of documentation, but I want you to be aware of, right? If your records get subpoenaed or someone asks you to testify on their behalf, we want to make sure that that documentation is very behavior based, right, and provides a clear and detailed description of what happened. Again, we want to always be driving that home to the perpetrator, right? That it is the domestic violence offender's decision to be abusive, right? It is never the survivor's fault, right? It is a choice and a decision that that perpetrator is making. Alcohol and drugs, right? Although it may co-occur when domestic violence is present, and it may be a contributing factor, it may make the abuse worse sometimes, or engage in more physical violence, right? But alcohol and drugs is not the cause of domestic violence. A loss of control is not the cause of domestic violence. Perpetrator, it's all about actually having and gaining and maintaining power and control. So oftentimes perpetrators are very intentionally making decisions. They are very much in control of their behaviors and their actions. So it's not about poor impulse control. It's not about poverty or lack of education. In my career, I have worked with many, many perpetrators that have all kinds of money and resources and education and status in their community. It's never because of someone else's behavior or being triggered, right? That perpetrator is making a decision to be abusive for the purpose of gaining and maintaining power and control. It's not about anger. Perpetrators are often very, very skilled at managing their anger. And it's not about stress, right? Those things may all be occurring at the same time. They may be contributing, but they are not the underlying cause. I want you to think about, right, what can substance use workers and professionals do, right? They can be mindful, right? They can look for and recognize indicators of domestic violence. They can be aware of the intersections of domestic violence and substance use. They can provide survivor-centered, trauma-informed, and culturally reformed responses to both perpetrators and victims of domestic violence. They can partner with and build relationship with their local domestic violence agency and program, and provide resources and support to both victims and perpetrators of domestic violence. And we didn't talk a lot in this presentation, we didn't talk at all, right? Time is limited, about the impact on children, right? But oftentimes perpetrators of domestic violence and people who are using substances are also parents, right? And so it's possible that you could be working with a child that's growing up in a home where they're experiencing domestic violence. So that's also something to keep in mind. This is the New York State Domestic and Sexual Violence Hotline number. And you can reach out to this number 24/7. It is available, support is available in every single language. You can also use our text and chat line. And we encourage people to reach out to us if you have a difficult case, right? If there's a difficult situation, if you're concerned for someone's safety, if you don't know how to respond to a victim or a perpetrator, right? You can reach out to the hotline and they can give you support and connect you to your local program. This is also the resource that you want to provide if you are concerned that someone is experiencing domestic violence. You can offer to them that they can call the hotline. You can give them that number. You can talk to them about how to save or store that number in a way that feels safe for them. And you can offer them access to a phone to call the hotline from your office if that feels safe or comfortable for them. But again, we never want to force someone or tell someone that they have to reach out to access services and support. There are 91 licensed residential domestic violence programs and 82 approved non-residential programs in New York State, serving every single county in our state. They are also, these are often the same services that New York State Domestic and Sexual Violence Hotline will connect people to, but you can also refer them to this information directly. And again, we want to always be promoting survivor choice and demonstrating a trauma-informed approach, right? So that we're not forcing people to make connections and call hotlines. There are also 53 certified rape crisis programs in New York State, and they may also be a resource for people that you're working with and providing services for. Domestic violence programs will do safety planning. They will do system advocacy and support. They will go to court with people to maybe file for an order of protection or custody or child support. They may go to law enforcement to file law enforcement to file police reports. They offer every DV program also has a hotline and an emergency shelter. They also do crisis responses, and they also work with people who don't want to leave that situation, right? They can provide counseling and support to survivors and their children while they are still living in a situation or experiencing domestic violence or sexual abuse. The rape crisis programs often to provide crisis counseling, and they also will do forensic rape exams. And I can also provide all of these resources in a follow-up as well. So in terms of making referrals for perpetrators of domestic violence, right, what we want to do is we want to send people to those abusive partner intervention programs, right? That is where the domestic violence is going to be addressed, and they will not be allowed to make any other excuses for their behavior or blame it on their anger or their substance abuse. So sometimes they're called offender accountability programs. They used to be called batterer intervention programs. We really kind of move away from that now because that tends to connotate only physical violence. And we know that domestic violence is not only physical. If you're going to refer someone for individual treatment, we want that to be someone in the community that has an understanding of domestic violence and is aware that this person has perpetrated domestic violence. Anger management should not be used as a referral for people who are perpetrating domestic violence, because it's not about anger, right? It's about power and control. So referrals for the domestic violence offender, right? Like I said, not anger management. We are not going to send people to anger management because this is not about anger. It's about gaining and maintaining power and control, right? So those really domestic violence offender accountability programs or abusive partner intervention or men's behavior change programs. And unfortunately, although we have programs for victims and survivors in every single county does not have an offender accountability program. And so if you end up referring that person for individual treatment, right, you want to make sure that you are sending them to a provider that understands the dynamics of domestic violence. You can find us on Facebook, on Twitter, on Instagram, all of our social media platforms. And I want to thank you, all of you who are listening to this today, right? Like I said earlier, we know that we always have survivors of domestic violence in our classes just due to the prevalence and the numbers of people who have experienced domestic violence. And so I want you all to know as well that there is services and support available. And I want to thank you for being here today and listening to this presentation.
I want to thank the New York State Office for the Prevention of Domestic Violence and Bonnie for joining me today. I hope you all find it useful while assisting clients in need of services. Your feedback's important to us. It helps us to know if we're meeting your educational goals and expectations. Once you've viewed the presentation in its entirety and completed the quiz, if you're prompted, please follow directions to access the SurveyMonkey website and take a moment to complete the evaluation, including suggestions for any future topics for Learning Thursdays. Once again, thank you for joining us and keep up the good work.